Okay, so good afternoon, everyone. We can just get started. My name is Jill Jensen, and my pronouns are she, her, hers. I'm an intern at the Women's Center, and I'm also a student in the Masters of Social Work program here at UW Oshkosh. I want to thank you all for being here today. This discussion is part of the Sexual Assault Awareness Month programming, and this space will be utilized to discuss trauma-informed strategies for supporting victims and survivors of sexual violence. So as Dr. Johnson said, you can, if you have any questions or thoughts, just either put them in the drop box or raise your hand and you can speak on camera if you're comfortable. Did we want to do introductions, everybody, or just kind of hop into the discussion?
Yeah, maybe Gabby could introduce herself. That would be nice.
I can do that. Hi, everybody. My name is Gabby Schwartz. My pronouns are she, her, hers. I am the Campus Sexual and Interpersonal Violence Prevention Coordinator. I am also one of our confidential advocates on campus. So I work individually with students who've experienced sexual and interpersonal violence to be a support and connect them to resources. You might notice my dog Georgie, you might hear her. So I'll mute myself, but she also just might pop in to say hello because she's likes to do that. Yeah.
Georgie is a great supporter. And I'll introduce myself as well. My name is Alicia Johnson. My pronouns are she, her, and hers. And I direct the Women's Center. And the Women's Center, we don't do direct response for victims and survivors in terms of in a confidential capacity, but we work closely with Gabby on prevention and support victims and survivors in other ways. And so this is a great opportunity for us to just share about some of our experiences and for you all to ask questions and share about your experiences.
Thank you both. So just first and foremost, it's not always easy to know what to say to someone if they tell you that they've been sexually assaulted. I know for myself, it can be quite challenging and it's kind of a dilemma. But for a victim and survivor, disclosing to someone can be extremely difficult, and this does take a lot of vulnerability and courage. It's important to be supportive and non-judgmental as possible. If the victim survivor is willing to talk about the assault, be willing to be that listening ear. And I think listening is one of the most important approaches, especially a trauma-informed approach. And that's kind of one of the main strategies that comes to my mind first. When victim survivors are sharing their experiences, just don't interrupt or interject what they're saying. I think this happens too often because there's really nothing people can do to fix what happened. There's just a lot of things people can do to help them moving forward. So, listening to the victim survivors' experiences and stories and saying, I'm so sorry, how can I help? The how can I help questions are important for a couple reasons. The first being this individual is sharing the experience in which someone took all their choice away. So you're pretty much allowing that individual to have some choice and giving them some power back. So I think listening is one of the main strategies that I just wanted to share first. And then if anyone wants to add on to that, or if there's another strategy that comes to mind, definitely just share.
I really like that Joe brought up the question of how can I help you? How can I support you? That's a favorite question of mine because I think a lot of times it gives the individual that control piece back, allows them, when someone who's gone through sexual or interpersonal violence, they've really just had their boundaries totally ignored and violated, and asking them for how you can support them, for them to articulate that boundary that gives them that choice back that they've just had taken away from it. I also think it's one that people remember. So someone might disclose and you say, how can I support you? And they're like, I don't know, because they're just really having a lot of feelings and a lot of emotions, and that's okay. But then maybe in a couple days, a few weeks, they're going to think about like, oh, I have this like appointment coming up. I wonder if this person knows someone who can come with me to that. Or I wonder if they would be willing to walk there with me. They're going to think of something, and they're going to remember that, oh, Jill asked how Jill could support me. So maybe that's a person I can bring that back to.
Yeah, and I do think that it's just overall empowering for the victim survivor, just giving them those choices. So yeah, and I like what you mentioned about it, that sticks with them and it's in their mind, and they see you as somebody that they can trust. You're kind of that safe person. And then I also wanted to bring up, and I'm sure we all are aware of this, but we do live in a society that's very victim blaming. So if anybody had any, thoughts about how we can support victim survivors in such a victim blaming culture, if anybody has any ideas to throw out.
I had something not directly about that, but just kind of in response to your first question. I think it's really important to let the survivor know that everything that happens after is their choice, as far as if they want to report, if they want to do the exam, what they want to do after telling someone. I think that's oftentimes, like I've even heard myself, oh, if you get raped, you have to go to the emergency room, you have to do this, you have to do that. And I'm like, no, actually, none of that has to be done. And so I think it's just really important to be one of the first things, as far as that they get to be in control of what happens next. That it's not anyone else's decision what happens after that.
Yeah, and that's such a big point, and I'm really glad that you brought that up. So thank you. Yeah, the decision to go forward to the police, the university, a medical professional, or a counselor really is in the decision of the victim survivor and nobody else. So yeah, thank you for bringing that up. And then it looks like we have a comment in the chat. Beth wrote, making sure that they know that you believe them is important too. Yeah, 100%. I think that, if someone mentions anything that even might suggest that they are in some way to blame, or even if they don't, really letting them know that they did not cause this, they are not at fault for what happened to them, and just validating their feelings. I think that's something that is extremely important, just validating their feelings and assuring them that, again, this is not their fault, because they really are the victim in this situation.
Yeah, and I wanted to offer some, perhaps some examples of victim blaming questions that people might not be aware are perceived or experienced as being victim blaming, but questions like, well, what were you wearing? Were you drinking? Were you alone? Did you leave your friends? So all of those questions, like somebody might think that they're being supportive and trying to understand, but what that communicates to the person is that you're saying, the choices you made led to this violence against you, but it is never the person's fault. It is always the perpetrator's fault. It was their decision to enact violence against a person. And I really wanted to amplify what Beth had shared too about starting with believing. So today is actually Start by Believing Day. So I dropped a link in the chat. There's lots of days within Sexual Assault Awareness Month, and this is one of them. It's a campaign to help people really start in a space towards supporting a victim or a survivor by believing the person. And I think that starting with that believing them is a really good place to ground yourself in, because there are so many like internal questions that a person is going to ask themselves. They might blame themselves or internalize that societal culture that is kind of perpetuated in media and in other institutions. But really, we want to make sure that in order to support someone, that they know that we believe them, that we know that it was not their fault.
Yeah, that's a really good point. And to add on to that, I think, trying to avoid those why questions, like, why didn't you report sooner? Or why didn't you call the police? Those do come off as very victim blaming. And I can see, that might be pertinent questions that you might ask yourself. But at the end of the day, those aren't helpful questions, and it will make the victim survivor feel as though, because I didn't report or because I didn't go to the police, this is my fault.
Yeah, I think to expand on that, really the questions that question the victim survivor's actions are the ones that can come across as victim blaming. So asking, well, why didn't you save the clothes you had or collect evidence? Like, who thinks of that in the moment? Not a lot of people, I can tell you from my experience as an advocate. And that's okay. The victim survivor's primary focus should be safely leaving the situation, not collecting evidence for decisions they might make down the road. I feel like I had so many pieces I wanted to add. Jill mentioned talking through like different options that are available. And I just wanted to emphasize that that is something students can do with myself before making a decision. I meet a lot of times with students who like, I'm not sure yet what I want to do. And we can lay out options and talk through that. So if students are looking for a place to process and think through those, our advocacy office is one of those options. I wanted to emphasize that people will remember reactions. So just like they might remember the really bad response, like you're going to remember the person that was victim blaming and accusatory of your actions, but you're also going to remember the person who believed you and supported you and just listened to you. Okay, and I had one more. I think along with that, your actions really speak a lot to whether or not individuals feel like you're someone they can come to. So like I can distinctly remember like people I went to high school with, and I'm like, I've seen what they post on social media. Like that would not be anybody that, like, I hope nobody discloses to them, because they're not going to be a supportive person. And so that's not my like old parent thing of like, watch what you're posting on Facebook, but thinking about how other people perceive that because they remember. Oh, and okay, my other point was trauma and the brain. And Jill said something about like, why did you wait so long to report? So I have a whole presentation on trauma and the brain that I just wanted to emphasize that, for very briefly summarize, when individuals go through trauma, there's a whole process for how your body releases certain hormones. And some of those hormones have protective factors where they like numb your effect and ability to experience like physical pain, which is protective. But that overload of hormones impacts how the brain pieces together that event and that time frame. So a lot of times victim survivors don't remember pieces of what happened, and they don't remember it right away. Things come back very randomly. The memory is very fragmented. And I think we also live in a victim blaming culture. So when sexual violence happens and it's somebody that or somebody that you're in a relationship with who has caused that harm, people don't always want to think about it as sexual violence because they know the victim blaming culture we live in and responses that people might have. And so I just wanted to emphasize that the brain doesn't always work well for trauma survivors, in that it doesn't piece things together well. For people to recollect these memories in a way that someone who hasn't experienced trauma thinks that they should.
Yeah, thank you, Gabby. Yeah, the whole trauma impact on an individual is, I mean, especially the neurobiological aspects. We do see in law enforcement, there's a lot of these cases that they don't even move forward with because they don't believe the victim. And then, they're like, well, their stories aren't making sense. But when you look at the neurobiology aspect of trauma, it starts to make sense. And hopefully, these departments are receiving more training on that aspect, because I do think that it's extremely important. So yeah, thank you for sharing that. I also wanted to kind of going back a little bit about like the choices. I think it's hard to see people that we care about not wanting to get help for something traumatic. We really want them to go to counseling or get therapy, but they don't want to do that. So, this is even a question for anybody, but it's, how do you get over that hump? Because you still want them to receive some sort of help, and you don't want them to kind of spiral downwards. And, keeping the listening and checking up on them. But do you have any advice for people who, still want their loved one or friend to get help?
I think that's a really great question. And I think that's something that a lot of people think about and struggle with, because it's hard to watch people you care about experience something painful. I think part of it is a frustrating response to your question is that like their decision is their decision, right? Like you don't get to be upset that they're not going to counseling yet. People might never go to counseling, and that's okay. sometimes it just takes a while. I think patience is huge, which I am not normally a patient person, so I kind of can't believe I'm suggesting that, but it is a thing, and continuing to be that present support. Not every day suggesting different options, but if you go to an event and you hear about, oh, there's this group at this community space, I thought of you. I wondered if maybe that would be a helpful opportunity for you. You can continue asking the "how can I support you" question. And some people might say, you can buzz off and I'll let you know when I need something. And you can be like, okay, that makes sense. I think it's also important to acknowledge secondary trauma, and that it's okay for you to seek support for yourself if you have heard a disclosure or you have a friend who's really struggling. And I think it's okay if internally you're kind of like, gosh, I wish that they would really get the help. Like, I can see that this is really hard for them. I wish that they would get some support, but also recognizing that they get to do that in their own time. I would, again, advertise my office. I absolutely am open to having conversations with people who are like, it's just really hard, and validating that it is hard to watch friends go through that. I think we also have to think about the intersectionalities that our friends might hold that maybe we don't. And recognizing that there could be a deeper reason as to why a friend isn't reporting. They might have an experience that you know nothing about and that they haven't shared with you that is related and is a reason why they're not reporting. Or they might have had a really invalidating counselor, and that's why they haven't been able to go back to counseling yet. So just recognizing that there are experiences that people have that impact those decisions, and would then kind of validate why they might be hesitant to seek support. And I think it's important for us to recognize that we just might not know that.
Yeah, no, I definitely agree. And I think it's good to emphasize the offering choices, but then ultimately supporting what they decide to do. And, we might not be necessarily like happy with the choice that they do decide, but ultimately supporting, because the point really is to put the power in their hands and let them regain some control. So.
Yeah, so I want to just like build upon that a little bit too. And one thing that I like to remind folks of is that healing is not linear. We don't just go from the experience of trauma to healed. Healing is a journey, a lifelong journey, and there are ups and downs. So I think one way that you can support a victim or a survivor is by like seeking out resources or educating yourself about trauma and trauma response. There's lots of great resources, obviously here on campus, but also all around the country. A classic book that is often referenced or recommended is The Body Keeps the Score, and that will really take you into a deep dive of the like trauma research and how we hold these trauma memories in our bodies and how the brain works and all of that. So that would be one recommendation. And then the other is to know your boundaries, like know your limits. And so it might be different if it's a friend or if you're in a professional capacity. Like for me as a professional employee, I'm currently a responsible employee, meaning that I have to report any disclosures of sexual misconduct. So being upfront with the person saying, like if you share with me, I'm happy to listen, but I do need to provide a formal report to the university, which all that means is they're going to follow up with the person and either offer support resources or offer options. And so as a friend as well, like knowing myself and when I can and cannot provide support, right? So I think being honest and direct with the person to say, you know, I really want to support you. And if the ask of how they're asking you to support you or to support them is too much, or you're not comfortable, you need to say that and share that with them so that they can seek other people for that type of support. So knowing your limits, knowing your boundaries, and really just communicating them will be really helpful. And just because you can't support somebody in one capacity doesn't mean that you can't support them in another.
I just kind of wanted to mention too that when it comes down to any type of healing and, you know, especially counseling, that can't happen unless the person's ready. So you can say, hey, you really need to do this, but if they're not ready to do it, it's kind of pointless in a way, because, you know, it's good to offer them the options that they have, but know that ultimately here it does have to be their decision. Again, kind of going back to choice, it has to be their choice to actually seek the help, because otherwise it's not going to help them.
Yes, absolutely. That's a really good point. It really isn't linear. And I like Dr. Johnson's point about it's not an easy process. And I think, you know, the boundary aspect is important because as people who are supporting, it's not our job to fix the victim survivor. It really is their journey and their recovery journey. And secondary trauma as well. I wish I knew more about that, but yeah, I feel like you as a supporter, I mean, you can do what you can, but you know, it will come down to the victim survivor making those steps. But yeah. I also wanted to talk a little bit. Oh yeah. Yeah, Gabby, that would be great if you could kind of touch on that.
There we go. Okay, I'm on my personal laptop, which is like 8 years old, and it's really struggling. And I had a tab open to look for a different resource to drop in the chat as well. So then it took a while. I apologize for the delay. Yes, an overview of secondary trauma. Some people call it vicarious trauma, secondary trauma. People also talk about it in relation to burnout. Something that is talked about a lot in the field of sexual violence and those of us who provide direct services to victim survivors, and occurs when you're hearing recounts of these really traumatic and awful experiences that people are having. And it can happen where it feels like your body is also then living it. And responds in that way. So the stress, the hypervigilance, affecting your sleep are things that absolutely can happen when you're hearing these recounts. And that is why, that's why they encourage advocates to have counselors themselves. And I think counselors to have counselors who have counselors, because it's helpful to have someone to process those with. And while it's absolutely important for a victim survivor to know that they're not alone, it's also important to know that for support persons, you're not alone. And it's okay to seek someone to process how you're feeling about it. Hearing these accounts can also bring up memories that you might have, can also trigger the fragmented brain to then connect with an experience that maybe you hadn't thought about, or that your mind had pushed away and ignored. I was going to drop a link in the chat for a book called Trauma Stewardship. I was struggling to find the title because it's on loan to a colleague. So I don't even have it on my bookshelf. But it's, and I haven't read it all yet, but really pieces together how those working in trauma and hearing trauma, it really focuses on that secondary trauma piece and how you can go forward getting support. And I think it's important to acknowledge getting that support for yourself in a respectful way. So not going to your group of friends to say, Jill told me this, and I need someone to process it with, but really seeking a resource where you can talk about, because it's somebody else's experience. Yes, that's the book. It's somebody else's experience. So while it's important for you to process that to avoid your own reactions with secondary trauma, making sure that you're not sharing that person's experience without their okay.
Yes, thank you for that. And those links look really interesting as well, so thank you. So another point I wanted to bring up is, you know, like checking in. So if you had somebody who, you know, told you about the incident and then it's, you know, a couple months later, you know, I feel like there can be kind of this feeling inside like, oh, should you bring it up? Should you not? You still are curious how they're doing. Maybe they haven't opened up to you since then or haven't really talked to you about the situation. Do you have any tips for people who want to reconnect with someone or, you know, check in?
Yeah, I see that Gemini's typing, so I'm really curious to hear what she has to say as well. But I think we kind of talked about this last night at one of our Gray Zone events, talking about boundaries and expectations. A good question to ask is, along with how can I support you, is how do you want me to check in? Do you want me to check in? And, you know, for that person, they might say, well, yeah, if it feels like I'm really distant, like it'd be nice to hear from you, see how I'm doing. I'm like, no, I don't really want to talk about it. And I don't really want to check in. I think it's still okay to, you know, make sure that they know that you're thinking about them and that you're there. So I think, again, kind of going back to giving that person that control is also like having them articulate how they want that check-in. Because maybe they want texts, maybe they don't. You know, in your head, you might think, gosh, I haven't heard from them in a really long time. I should probably send 5 or 6 text messages until they respond. One emoji every text to make sure they're doing okay. And they're like, oh my gosh, Alicia won't leave me alone. Like, this is so stressful. So really allowing them to set that boundary and that expectation of how they want to have you show up for them, and what check-in that is. And I think a benefit of being here today and attending other programs throughout April is learning about resources. So to go ahead and say, I know Gabby and she seems okay. You know, maybe if you decide you want to talk to her, like I can figure out how to get in touch with her if that's something you're interested in at some point. And then they just know, kind of putting things out there of like, okay, I'm aware of this resource, and like if you want me to look into it, like I can do that. And not like doing the work for them, but helping them to be aware of resources. So the more you know about those is a really helpful piece for others who have experienced trauma. Thank you, Gemini.
I know one thing I wanted to mention too is kind of coming back to a couple things that we talked about in, like, if someone decides to share their story, I think it's extremely important to not say, is that what that was it? Or there has been people that have had that worse. Cause I know when I came out with being as a survivor, someone's like, oh, well, you know, what happened? And oh, that's all that happened. And I'm like, really? Um, because one of the best like memes I've seen was that someone that drowns in 1 foot of water is the same as someone who drowns in 7 feet of water. They still drowned. So I think it's just really important, and it's probably not as, they're probably not doing it. You know, you may not do it as being trying to be mean, but I think it's a really easy thing to compare. You know, as a survivor for myself, or even just as someone that's supporting of things they've heard in the past. Oh well, that wasn't that bad because I've heard this story and this was way worse. So I know that I've experienced it personally, and I've heard it so many times, like on the media stories you hear, you know, that you hear that all the times of, oh well, that wasn't that bad of a situation because I heard XYZ this story and that was way worse. And it's just really important to know that everyone that goes through any sort of trauma should be just as validated as the next person. And it doesn't matter to what level they experience it. If they experience trauma, they experience trauma. And that should be it.
Yeah, I mean, it really comes down to just validation. I absolutely hate that, you know, oh, other people have it so much worse, or it could have been worse. Yeah, I mean, seeing it as what it is, and you know, that's their experience. That's what they went through, and it's not your experience. So thank you for bringing that up. Sorry, my notifications are so loud.
I think Gemini brought up a really good point that everybody experiences trauma differently. And I think media just likes to pull and say terrible things about. So I think media just like brings all of this attention to things, and they're like, look at this really, they really feed into rape culture and victim blaming, and myths about how sexual violence happens. And they call attention to that. And then if that's all someone's hearing, and then they hear someone's story, they do that comparison. And it is extremely invalidating to say that to someone, because everybody's trauma is trauma. And this goes beyond sexual violence trauma. Like, trauma happens for those who live through natural disasters, who lose loved ones. Like, trauma is trauma, and it affects everybody differently. And nobody else gets to define how that trauma affects that individual except for themselves. So absolutely. And I think it's also something that victim survivors sometimes do internally, of thinking, well, my experience wasn't as bad as so-and-so's. And so I think a lot of the questions that we hear in society that are
Well, it looks like she froze. We can just wait a minute just to see if she comes back.
I always said I would never want to be on TV because I always seem to pause the actors or actresses at the very worst moments. And this is part of the reason, is because when you glitch or something like that, it's always at the worst possible second.
While we're waiting, does anybody have any questions they just wanted to add or anything?
So Jill, you mentioned earlier trauma-informed. You kind of dropped that term. Do you mind giving an overview of what it means to be trauma-informed?
Yeah, well, you know, so like in a classroom setting, so, you know, sexual assault victims, survivors, if they are in a classroom that is not trauma informed, there could be a lot of negative consequences. So, when I was doing some research on this, I'm actually working on a trauma informed care training that the Women's Center that I'm doing for my internship, and we're going to be implementing that coming this fall. But through that research, what I found is that, you know, the learning or, you know, victim survivors in a classroom, teachers really need to tailor the learning, the curriculum to accommodate those students. Because if they don't, they were finding that students were experiencing more withdrawal and they weren't as engaged from the course content. So it's just creating, so being trauma informed is creating an environment that, you know, validates a victim survivor. It gives them the choices. It puts power back in their hands. I could go on and on about it, but that seems like a brief example. So, you know, in like a classroom setting, with victim survivors of sexual assault, you know, things like trigger warnings, you know, to let them know that this material will be talked about. And survivors and victims, they don't not want to talk about this because talking about this furthers the conversation. But it's, you know, with the neurobiology aspect of trauma, if a topic on sexual assault just springs up, there could be consequences with that. And it's just providing a safe environment, essentially. I hope that was messy, but
That's okay. So I think one really like brief and quick way to reframe or to think about trauma-informed care is instead of asking like what's wrong with you, we ask what happened to you, right? So that calls out that there are external factors that impact the way that we interact with our environments. And welcome back, Gabby.
This is what happens when I try to get comfy cozy for an event and not be at my desk for once. And I even tried to send a chat that said, so sorry, but it's not sending. So I'm on my personal hotspot because apparently my Wi-Fi doesn't want to work. So I missed what we were talking about, but it sounds like you covered trauma-informed care well.
Yes, and I do have a question here from another intern about how do we support someone who doesn't know how they want to be supported or how they need to be supported?
That's a really good question. I think just being present is really huge. Knowing that you're there, and if they decide something's helpful, that you're around, is really beneficial. And just, I think just helps them remember that you're there. Because I really don't think that a lot of victim survivors know right away what they want or what is helpful. Another thing within reason, I think, can be making suggestions. So they might be like, I don't know. And then they're talking about what they're experiencing, how they're coping, and, maybe they're talking about feeling really stressed about going to a certain place on campus. And you can say, well, I could go with you, or, oh, it's a nice day, let's take a long way so we don't have to go that way. Kind of listening to what they're saying, and finding those ways that maybe they don't know is an option. Or, they're really struggling with class, and you're like, I know the dean of students helps with that. Like, maybe we could talk to somebody there. Just knowing the resources, I think, and being able to say, well, that sounds really hard. Do you think this is something that we could try? But I think also just validating too, if they don't know, it's okay to just say, that sounds really hard or really upsetting. I can imagine that might be really frustrating to be experiencing. And just validating their emotions and how they're feeling is huge, even if they don't know what support they're looking for.
Yeah, I think it's better to just sit with them and talk and listen than to just distract from everything. I do think that people or victims, survivors, they do have to feel what they're feeling rather than trying to distract them. I do think that, being in my 20s, we kind of want to not think about that. So we're like, oh, well, let's not think about that. Let's just go to the mall or, whatever. But I mean, that's not very helpful in the long run. So I think just really sitting down and, again, even if they don't know what to do or they don't know if they want to do something, just hearing them out and supporting whatever they decide to do.
Yeah, and I think it depends like what role you're in. Sorry, Gabby, I saw that you were gonna jump in. So I think in some ways, like as a friend, right, like being part of that distraction, like if that's what they need in that moment, like that could actually be really helpful, right? To just be there with them while they're trying to take their mind off it. And so I think, again, like it depends on what role you're in, and, not pushing them one way or another, just being there to support them and let them decide what direction or path that they take. Sorry, I'll throw it to you, Gabby.
I was going to shift just a little bit and wondered if, while I was in technology limbo, we talked about touch at all. I think for those who might be who might feel and express love and care through physical touch, like myself, I'm a hugger. That's not always a helpful response to someone who has just had their boundaries in their body violated. So I think it's important to not rush in with a hug, not want to throw your arms around them, hold their hand, and which can sometimes be hard for people who like and we were like, oh my gosh, I feel terrible and this sucks and I'm angry with you and I want to comfort you, but just knowing that that is not something that all individuals might want, and that plays into consent, but like I ask pre-COVID, like students I work with of like, do you want a hug? Like I'm comfortable with that if students are, but also, you know, staff versus students, I'm not hugging all the students, but also clarifying like if you want a hug, I'm happy to give you a hug, but I have students that are like, nope, thanks, see you next week. And I'm like, that's perfect. Really allowing a person to have that choice, and just remembering that like sexual violence is violating, and you don't want to have that over concerned reaction that then scares them away because they're like, oh my god, Alicia's hugging me and I don't know what to do. Is she gonna stop? So just keeping that in mind, and asking, do you want a hug? Can I hold your hand? Whatever feels natural to you, making sure that you're asking that is helpful in responding.
Yeah, asking, definitely, I agree. Did anybody else have anything they wanted to include or add? We have about 5 minutes left.
Had to happen at least once, right? I'm going to share this link in the chat from Ryerson University in Canada, but they have this model called BRAVE for supporting victims or survivors if they disclose. So the BRAVE model is, the B is begin by listening, R is respect confidentiality, A is ask what support looks like to them, V is validate them, and E is empathize. So I think that's a nice way to sort of like bring everything that we've been talking about together, and something that you all can kind of keep in the back of your mind if somebody does choose to disclose to you, you know, knowing the resources, remembering the BRAVE model. But even if you can't remember that, just remember to Gabby, and she can get you connected to other resources or be that resource herself. And so we're obviously always available in the Women's Center as well to either connect to Gabby or to other community resources.
Gabby, did you drop your info in the chat? Or else I can as well.
I think because I'm now on my iPad that doesn't have a keyboard, if Alicia or Jill wanted to drop my contact info, that would be fantastic. Email is the easiest for me now, just because I'm working remotely and my office phone doesn't forward well to my cell phone. So I feel like I miss calls so frequently, unless I'm staring at the phone app. So email's super easy. I will also be adding, I have like a link in my email signature for students to just be able to click and book a meeting with me. And I will be adding that to our violence prevention website as well. So students there can, find our email, find phone number, contact info, but I will also add that button so students can just click that and it automatically pulls up my schedule and you can schedule an advocacy meeting with me without having to do a full email. And if you are like, I don't want to have to explain all the things, like just scheduling that will be an option as well.
Thank you, Alicia, for adding that in the chat. So, and then any last questions or anything like that? Yes, and then Alicia just put the evaluation in the chat box. Back to the. Okay, well, I mean, thank you everyone for coming to this discussion. A lot of important issues were talked about, and enjoy the sun. It's so nice outside. Thank you.